Role of incentive spirometer in chest physiotherapy. Presented by Dr. Jalal, Mohsin, Uddin. DTCD, FCPS Pulmonology. Assistant Professor, NIDCH. Introduction. An incentive spirometer spy-rom-uh-ter is a simple, plastic medical device that exercises our lungs. It can measures how much air one can breathe into lungs. An incentive spirometer helps to expand our lungs by taking deep breath. Utilities of an incentive spirometer. Helps to practice taking slow and deep breaths. With regular use, an incentive spirometer helps our lungs expand so we can take deep, full breaths instead of short, shallow breaths. Exercises our lungs and makes them stronger as we heal from surgery. Incentive spirometry, a respiratory exercise. Upward arrow, lung expansion. Prevent fluid and mucus from collecting. Risk of developing respiratory complications. Especially important, underlying lung diseases, overweight, chronic diseases. Recovering from surgery. Helps to clear out mucus that builds up in lungs. Keeping our lungs inflated, it clears mucus and other secretions from our lungs. Deep exhalations help prevent mucus and fluids from building up in our lungs. Keeping our lungs active during recovery in postoperative period will help to prevent lung infections, such as pneumonia. It helps to prevent lung infections by keeping expanded our lungs. An incentive spirometer, strengthening our lungs. One may have low oxygen levels after surgery or a serious illness, and an incentive spirometer helps us to achieve a normal oxygen level. Recover from anesthesia quickly. An incentive spirometer helps clear anesthesia from lungs. Type of incentive spirometer. There are two types of incentive spirometer. Flow-oriented incentive spirometer FCPS. This device makes us work harder to breathe. It helps increase the muscle strength in upper chest. Volume-oriented incentive spirometer VIS. A VIS device doesn't make you work as hard as an FCPS device to breathe. It helps improve activity and movement of our diaphragm. Equipment. Incentive spirometers are available either by measuring the volume of inspiration, volume-oriented devices, or measuring the flow rate, flow-oriented devices. Flow-oriented FCPS incentive spirometer 3-ball. A standard flow-oriented incentive spirometer consists of 3 chambers in a row. The patient inhales through a mouthpiece connected to the unit with the 3 chambers. Each chamber contains a ball that has printed on the outside of the chamber the least amount of flow needed to raise the ball. With an airflow rate of 600 to 1200 milliliters mil per second, the deep breath lifts the balls. When all 3 balls reach the top of the unit, the patient has reached a flow speed of 1200 ml/second. The colored balls indirectly give the patient a visual indication of the inhaled volume. The visual feedback works to improve compliance in performing the slow, sustained deep inspiration. Volume-oriented incentive spirometer VIS. The most common volume-oriented incentive spirometer is a mechanical handheld device that uses a one-way valve to block exhalation into the device. It consists of a corrugated hose and a mouthpiece that connects the patient to a plastic chamber. Next to the central chamber of the spirometer is a slider. The medical provider can use the slider to set a target breath volume. The target breath volume can be based on the patient's age, height, health, and condition. When the patient breathes in through the corrugated hose, the piston in the chamber rises, which indicates the volume of displacement via an indicator on the device. There is a smaller chamber on the spirometer that measures the speed of the breath. The ball in this chamber will go to the top if the patient breathing in too quickly, and will go to the bottom if breathing too slowly. Once the patient has achieved maximal inspiratory volume to the best of their ability, the patient is requested to hold the piston in the same position for 5 to 10 seconds. After completing the inhalation and maintaining that inhalation for the appropriate amount of time, the patient is instructed to remove the mouthpiece, allowing gravity to return the piston to its original starting point. Which one is better? Volume-oriented devices cause less effort with breathing and more exercise of the diaphragm, whereas flow-oriented devices cause increased muscular activity of the upper chest. Volume-oriented incentive spirometry has shown to be more effective in improving pulmonary function, functional capacity, and functional difficulty questionnaire when compared to flow-oriented incentive spirometry and diaphragmatic breathing exercises. Who should use incentive spirometer? 1. Rib case injuries. Several complications can follow rib fracture. Patients suffering from rib fractures frequently complain of chest pain, which can be associated with obstruction of the lower airway or impaired lung hygiene. This can lead to atelectasis and hypoventilation. Atelectasis is the most common complication following rib fractures. Incentive spirometry has been shown to decrease pulmonary complications in patients with rib fractures and improve pulmonary function. 2. Patient taking prolonged bed rest. Prolonged immobilization affects almost every organ system in the body. Respiratory complications include decreased ventilation, atelectasis, and pneumonia. Atelectasis is the collapse of the entire lung or part of the lung. It occurs when the alveoli within the lungs become deflated or filled with secretion. 3. Asthma, as it causes our airways to become inflamed, tighten, and produce mucus. 4. Pneumonia. Pneumonia causes air sacs in our lungs to fill with mucus and other fluids. An incentive spirometer helps loosen mucus and fluids from lungs. 5. Chronic obstructive pulmonary disease (COPD). An incentive spirometer can help to alleviate symptoms. Inspiratory muscle training by incentive spirometer use have beneficial effects on exercise capacity and exertional dyspnea in patients with COPD. 6. Any general surgery requiring hospital admission beyond 1 day, incentive spirometry can be used with other aspects of pulmonary rehabilitation, including deep breathing techniques, directed coughing, adequate pain control, and early mobilization to prevent postoperative pulmonary complications, example, atelectasis. 7. Video-assisted thoracoscopic surgery VATS for lung cancer. The use of incentive spirometry and inspiratory muscle training for patients with lung cancer that choose to undergo surgical resection via VATS has been shown to assist with lowering hospitalization costs and decreasing the prevalence of pneumonia. 8. Cystic fibrosis, as cystic fibrosis causes mucus to build up in lungs. 9. Sickle cell anemia. Sickle cell anemia is an inherited blood disorder. It can cause cells to clump together and can clog blood vessels in lungs, which may cause chest pain, cough, and trouble breathing. 10. Atelectasis, as atelectasis prevents lungs from properly inflating. 11. Children with cerebral palsy. Incentive spirometry has been shown to enhance pulmonary function and breath control for speech production in children with cerebral palsy. 12. Patients with neuromuscular disease or spinal cord injury. Cervical and upper thoracic spinal cord injury cause impairments in respiratory muscle performance, leading to pulmonary dysfunction and making deep breathing difficult for affected individuals. Patients with tetraplegia have a more compromised pulmonary function as compared with patients with paraplegia. Respiratory muscle training should be a focus in all spinal cord injury rehabilitation programs, especially for patients with tetraplegia, as well as those with chronic spinal cord injury. 13. Ankylosing spondylitis. Incentive spirometry may improve pulmonary function and arterial blood gases in patients with ankylosing spondylitis. 14. Multiple sclerosis. Resistive inspiratory muscle training may effectively improve maximal inspiratory pressure in people with mild to moderate multiple sclerosis. 15. Parkinson's disease. Inspiratory muscle weakness may be present in the course of the disease. In the more advanced stages, limited chest mobility, poor posture, and lung expansion contribute to less effective coughing. This could lead to the occurrence of aspiration pneumonia, which is among the highest risk factors for mortality for patients in the advanced stages of Parkinson's disease. Inspiratory muscle training with incentive spirometer can be helpful when people with Parkinson's disease are experiencing respiratory dysfunction. 16. Idiopathic pulmonary fibrosis. Breathing exercise with incentive spirometer has been shown to alleviate respiratory symptoms and improve exercise tolerance. The improvements may be related to the chest expansion during deep breathing exercises and the stretching of the thoracic muscles, resulting in a more efficient breathing pattern, improved respiratory muscle strength, and pulmonary compliance. Incentive spirometer should be considered at any stage of the idiopathic pulmonary fibrosis disease process and in patients awaiting lung transplantation. 17. Other interstitial lung disease. Interstitial lung disease is one of the most serious pulmonary complications of connective tissue diseases. Non-pharmacological interventions include exercises such as walking, strength training, inspiratory muscle training by incentive spirometer, and breathing exercises. How to use flow-oriented FIS incentive spirometer. 3-ball sit on the edge of your bed if possible. If you can't, sit up as far as you can in bed. Hold the incentive spirometer in an upright position. Place the mouthpiece in your mouth and tightly seal your lips around it. Breathe in as slowly and deeply as possible. You will notice a 3 balls rising toward the top of the column. Try to keep the 3 balls red, yellow, and green at the top. Hold your breath for as long as possible, or at least 5 to 10 seconds. Exhale slowly and allow the balls to fall to the bottom of the column. Rest for a few seconds, and then repeat the first 5 steps at least 10 times every hour you're awake. After each set of 10 deep breaths, cough deeply to clear your lungs. If you have an incision from surgery, firmly press a pillow or rolled up towel against your incision when coughing to provide support. Once you can get out of bed safely, take frequent short walks and practice coughing. You can usually stop using the incentive spirometer once you can walk around. If you feel dizzy or lightheaded at any point while using an incentive spirometer, immediately stop using the device and alert your healthcare provider. How to clean incentive spirometer. If you have an incentive spirometer for home use, it's a good idea to clean it daily. Detach the mouthpiece from the base of the device and clean it with clean running water and antibacterial soap for about 20 seconds. Then wash the rest of the spirometer with water and soap. You can also put on protective gloves and soak the separate pieces in a 5% bleach and water solution for about 5 to 10 minutes. Periodically swish the pieces in the solution to help clean the device. Thoroughly rinse the pieces in clean running water after 5 to 10 minutes. Make sure the incentive spirometer is dry before your next use. Caution: if the patient has an active respiratory infection, he/she should not use his/her incentive spirometer around other people. If people don't properly clean and disinfect the incentive spirometer, it's possible for him or her to spread bacteria. Clean the incentive spirometer's tubing, breathing valve, and mouthpiece before someone else uses it. If one have cystic fibrosis, he/she is also at a higher risk of upper respiratory tract infections when he/she use an incentive spirometer or other lung function testing equipment. That is, infection may spread from lower respiratory tract to upper respiratory tract. Patients with bullous emphysema should be cautious of using an incentive spirometer with high intensity. The development of the pneumothorax may have been related to the patient's repeated forceful inspirations under resistance in the setting of emphysema and lung hyperinflation. Inspiratory breathing under resistance can cause large swings in intrathoracic pressure, resulting in increased stress on the lung tissue. Contraindications. Although there is no absolute contraindication for spirometry, the following conditions are considered a need for caution when performing inspiratory muscle training. The presence of a respiratory tract infection, hemoptysis of unknown origin, pneumothorax, uncontrolled hypertension, aneurysm, recent thoracic, abdominal, or eye surgery, nausea, vomiting or pain, and confusion or dementia. Thank you all. Role of incentive spirometer in chest physiotherapy. Learning pulmonology.